Welcome to Alberta Health Services Daily Mouth Care Demonstration Series. Today we will explore toothbrushing with the Modified Mouth Care Protocol. This protocol works well for residents who are likely to have swallowing or choking concerns, or residents who are more responsive to care. The protocol has two steps. First, brushing with a moist toothbrush where the gums and teeth meet to clean the teeth. And then second, applying fluoride toothpaste to protect the teeth from decay. This method reduces the amount of toothpaste foam created in the mouth and reduces the risk of choking. Sandy is a resident known to have difficulty swallowing and has severe arthritis in her hands, making it difficult for her to perform her own daily mouth care. When Brenda arrives at her room each day, she takes a few moments to greet Sandy by name and ask if she is ready to do her toothbrushing. Brenda then begins to gather the supplies that she will need. She includes a towel, face cloths, 2 cups of warm water, 2 toothbrushes, toothpaste, and water-based lip moisturizer. She also has a flashlight available to look into Sandy's mouth. Next, Brenda prepares herself for providing mouth care. During mouth care, Brenda will come across bodily fluids like saliva and possibly blood and nasal secretions. These fluids could expose Brenda to spreadable viruses or bacteria. After assessing this personal care situation, Brenda decides she could be exposed to bodily fluids on her hands and through droplets in the air. After doing her hand hygiene, Brenda chooses to don a mask, her protective eyewear, and gloves for this procedure. Now Brenda is ready to brush Sandy's natural teeth. Brenda places herself close to Sandy so that she can hear her easily. While looking into Sandy's eyes and using a calm and relaxed voice, Brenda asks Sandy if she can start brushing her teeth. She explains a little bit about what they will be doing today. Then Brenda places a towel on Sandy to protect her clothing. Brenda then dispenses a small amount of lip moisturizer and fluoride toothpaste onto the back of her non-dominant hand. This will make it easy to access during the procedure. Brenda is familiar and comfortable with Sandy, and she knows that she is usually cooperative during mouth care. So she chooses to use her finger to apply the lip moisturizer to Sandy's lips. The lip moisturizer will help the toothbrush slide into the mouth easier and will also keep Sandy's lips comfortable during mouth care. Brenda moistens the toothbrush with water and shakes out the excess water. This reduces the amount of fluid in Sandy's mouth that may cause her to choke. Brenda introduces the toothbrush at the corner of the mouth and gently moves the cheek outward to see the teeth and gums and soft tissue. She places her finger inside Sandy's cheek and with a relaxed hand she uses the toothbrush to sweep out any debris, food, and plaque using a mop-as-you-go technique. Now she is ready to begin brushing the teeth. At this point, it is not necessary to ask Sandy to open her mouth any wider. Brenda uses a short back and forth motion at a 45-degree angle to where the gums and teeth meet. She brushes the outside of all the teeth, completing half of the mouth easily. Brenda rinses the toothbrush as often as needed. Next, Brenda asks Sandy to open her mouth so that she can brush the inside or tongue side of her teeth. If the resident does not open right away, try singing their favorite song together or ask them a simple question. The question could be, "What did you have for lunch today?" Or, "When is your daughter coming to visit?" Now that Sandy's mouth is open and her teeth have parted, Brenda gently inserts the toothbrush between her teeth. Brenda now brushes the inside or tongue side of the top and bottom teeth where the teeth and gums meet. She continues to remove any excess debris or plaque out of the mouth and wipe it again on the towel. Brenda continues to talk encouragingly to Sandy throughout the brushing to let her know how the brushing is going. After brushing the inside of the teeth, Brenda brushes the tongue with the toothbrush. She begins at the front of the tongue and then works her way back. Brenda will observe for Sandy's gag reflex so that she will not go back too far on the tongue. After brushing, Brenda uses a flashlight to look inside the mouth. She could use either a toothbrush or a finger to pull the cheek back so that she can see all the teeth and tissues. If Brenda sees any changes or anything that does not look normal, she will report it to the RN or the LPN for them to follow up on. The last step is to apply fluoride toothpaste to help provide protection to Sandy's teeth from decay. Brenda picks up a grain of rice amount of toothpaste from the back of her gloved hand and applies it to the teeth with the toothbrush. You will notice that Brenda gently brushes the teeth with the toothpaste and does not create too much foam. Then she sweeps out any excess saliva and toothpaste onto the towel. These steps are important to reduce Sandy's risk of choking. It is not necessary to do any final rinse after the toothpaste. Leaving a small amount of toothpaste in the saliva allows more time for the fluoride in the toothpaste to work. Brenda's last step is to apply a thin layer of lip moisturizer again to Sandy's lips for comfort. In general, it is helpful to choose a time when the resident is receptive to receiving mouth care. Often after breakfast or lunch is a good time, as the resident is full and satisfied, and it provides an opportunity to remove any food debris from the previous meal. It is also helpful to choose a time when you, the provider, are not in a rush, so that both of you can enjoy this experience. These suggestions can also help you lessen the chance of care-responsive behaviors. In the next video, we will be demonstrating the modified mouth care protocol and toothbrushing with a care-responsive resident.